Thank you. Nola Honeysett from Dubbo Health Council. I've received a fax from Bernadette Underwood, who is on the Barradine Health Council and also Dubbo Health Council. She's a very passionate advocate for her community, and she has written this to Mrs. Skinner, and it is also on that subject, so I don't know whether you want me to hand this or read it, but it's certainly another angle, and it concerns her greatly, this retraining. So, do you want me to read it?
Yes, yes.
Right. These are Bernadette Underwood's words. As a nurse from an isolated area, and who incidentally returned to nursing after a very long break, and then worked for many years, I cannot believe that the government would support a new method of return to work program. To expect nurses who have been out of the workforce for 5 years to have a family to do an 8-week course at a cost of $10,000 is unbelievable. It was amazing to hear on ABC interview with the Minister making light of the problem, almost as though it wasn't a problem. There will be scholarships and we hope the training will be done in regional areas, she said. As though this would solve everything. These people have done the fundamental training which they are likely not to forget in 5 years. They are young women, very often trying to buy a home, so where does the spare $10,000 come from? And how are they to leave their families for 8 weeks? Are you looking at having no nurses and a breakdown in society as well? Why not have a practical return to work program where they work at the hospital they want to return to for a short period? They work under supervision with minimal pay. This would assist with the shortage of staff and gain extra experience. General nursing doesn't change, just the technology and medication, so time could be spent on upgrading these skills. Conditions now for nurses returning to work are difficult enough, and the role of enrolled nurses has become much more difficult as well. Why not try and make nurses' lives easier? It seems to be hard enough to keep the nurses we have. Let's focus on common sense, which really doesn't seem to be very common anymore. And God help sick people, as there is a further shortage of nurses. As I said, Bernadette is very passionate about it.
Okay, Nola, I think the Minister answered that. One thing that I might add to that, in my previous role at the University of Sydney School of Rural Health, we had a lot of tuition which came from Sydney, in fact came just down the road. Why can't we establish some sort of mechanism, with the APRA, where the tuition could be delivered locally, admittedly with all the correct curriculum, all that, and it would alleviate a lot of this problem.
Look, I'd be delighted, Joe, if the university would take it up. We've raised it with them and there's been no takers. I'm afraid it's to do with insurance that's making it so expensive. This is not something that I've dreamt up. This is a national scheme that all jurisdictions have signed up to. And look, there is the Nurse Reconnect program that is done at the local hospital where you do that extra training. But for nurses who've been out of the workforce for 5 to 10 years, it is believed that it's needed, that it's necessary for them to do retraining, first of all in a theoretical 4 weeks at the college, and then 4 weeks at the hospital where they've been able to get a placement. So we're trying to make it as easy as possible. I don't underestimate the value of these more experienced nurses returning to the workforce, and we're trying to, with our scholarships, reducing the cost down to $4,000 instead of $10,000, trying to make it as easy as possible. If people still can't manage that, I'd like to know about it, but will you please convey to Bernadette my concern that people really do understand it is about ensuring that nurses are up to speed with modern technology. My mother was a nurse. There's no way that she would have gone back to nursing without doing refreshers. And many of the nurses that I speak to say the same thing. They don't feel that they need that catch-up. And we're trying to make it, as I said, as easy as possible. If, Joe, you can persuade the clinical school here to provide it locally, I'll bless you even more. Thank you.
Thank you.
I'll take the challenge on.